I'm Dr. Steve Biko, a physician at the Kakamega County General Hospital. And you have asked a pertinent issue on dementia. So dementia basically is a functional neurocognitive degenerative process. And by that, what we mean is that there is alteration in thought, alteration in cognition. That is how you are linking your thoughts to your actions, and alterations in behavior. And basically all these things result in someone with a different thought process, which in most circumstances may tend to appear as bizarre. Now, under most circumstances, dementia is something that, or is an entity that was previously more documented in the West because of their aging populations. And the biggest cause were things like Alzheimer's disease, and there's a disease called Parkinson's disease, which is a movement disorder. Now, these diseases are also catching up with us because of aging populations. However, we have other causes of dementia in populations that are non-characteristic of age, and what we would describe as younger populations. And in our setup here in Kakamega, the commonest causes of dementia, especially in the young people, tend to be what we call vascular dementia. So vascular, what we are describing is an individual whose the brain structure has been injured by something. Most of the time, the commonest causes are strokes, or even injuries to the head from trauma or other causes. So you find someone has bled into the brain, or a portion of the brain has become injured, and as a consequence, they get these changes or alterations in their behavior and actions, which we will now call us or refer to as dementia. Now, there are other disease entities that could also give us dementia, and there are documented cases of HIV resulting in dementia, what is called HIV-associated neurocognitive dysfunction, which would actually present as dementia itself. Then we have other consequences of other diseases, things like meningitis, from whatever cause, bacterial, it could be TB, could also cause this, cryptococcal meningitis, which are common things that we see here. In younger people, this also give us dementia states. Now, we are also observing cases of these behavioral changes arising among people, especially young people who are on certain drugs, most of the time recreational drugs, things like alcohol, if used over a long time, also results in decline in brain functions, which can present like that. We have young people using things like bang in our societies, which is also resulting in the same thing. Yes. The process of, or when one has suffered brain damage, usually healing and reversal of brain functions is usually either very slow, or sometimes it does not occur, so you end up with a permanent state of dysfunction. Yeah, as I'd mentioned, you'll find bizarre behavior, that is abnormal behavior. You'll find someone with memory issues, things like remembering. You'll, as I mentioned, of course, the behavioral abnormalities. You'll get some with personality changes. Someone just assumes a different character trait, contrary to what they have been having. Things like disinhibition. Some people just display fits of anxiety. Some will go into depression. Basically, management depends on the cause. So if, say, you're looking at the younger population where it arises secondary to something else, then what the family can do is to just try and address the issues that would lead to the dementia. For example, if it is alcohol use or abuse, then the family can try and address this with the particular individual early. And if a medical intervention is required, then the family can also avail this individual for care or structured care early. Now, for things like vascular dementias, say that arise after stroke, then the best way we can prevent them is to prevent strokes. And that is another process. It starts initially with just lifestyle changes to reduce any risk factors for stroke in future. Yeah. Then there are some where you cannot do much. For example, like the age-related or age-associated dementias. This is like Parkinson's disease. If they come in, you just treat them as they are.